Cefpodoxime resistance. Have you ever wondered how antibiotics like cefpodoxime can sometimes stop working for our pets? Today, we will talk about cefpodoxime resistance and what it means for your furry friends. Cefpodoxime is a third-generation cephalosporin antibiotic commonly prescribed for bacterial infections in pets, especially skin infections in dogs. However, just like in humans, bacteria can become resistant to antibiotics, making treatment more challenging. So, what exactly is antibiotic resistance? It occurs when bacteria change in a way that allows them to survive despite being exposed to antibiotics. This can happen through genetic mutations or by acquiring resistance genes from other bacteria. When this happens, antibiotics like cefpodoxime may not work effectively against certain bacterial strains. Several factors contribute to the development of antibiotic resistance. One major factor is the overuse or misuse of antibiotics. If antibiotics are used unnecessarily or incorrectly, it can speed up the process of resistance. For example, not completing a full course of treatment or using antibiotics for viral infections can lead to problems. Incomplete treatment is another concern. If a pet does not receive the full prescribed dose of cefpodoxime, some bacteria may survive and develop resistance. Additionally, while cefpodoxime is often used off-label in cats and for other infections, this should only be done under the guidance of a veterinarian to minimize the risk of resistance. So, how can we manage antibiotic resistance effectively? First, it is important to use antibiotics judiciously. This means only using them when necessary and following the veterinarian's instructions carefully. Completing the entire treatment course is also essential to prevent the development of resistant bacteria. Regular monitoring for resistance is another key step. Veterinarians can perform bacterial cultures to identify any emerging resistance patterns. Proper disposal of unused or expired antibiotics is also important to prevent misuse. In veterinary practice, managing cefpodoxime resistance involves following specific prescription guidelines. Veterinarians should prescribe cefpodoxime based on the pet's needs and the type of infection being treated. It is also important to monitor for side effects, such as gastrointestinal upset or allergic reactions, which may requiring alternative treatments. In some cases, combining cefpodoxime with other antibiotics can be considered. This approach can broaden the spectrum of activity and help reduce the development of resistance. By understanding and addressing antibiotic resistance, veterinarians can help ensure that cefpodoxime and other antibiotics remain effective in treating bacterial infections in pets. Keeping our pets healthy is a shared responsibility, and being informed about medications is a great step toward that goal.